The same Damandeep, if had cracked in 2025, would you still choose radiology?
Beyond any doubt, I would choose radiology.
AI doesn't scare you.
AI can predict patterns, AI can sort it, but when it comes to validation of results, we still need humans.
Let's suppose doing a DM from AIIMS. What is the real career options in front of you?
Either he can directly venture into the corporate setup and can join in any corporate hospital.
You had a movie moment in your life. You played a real life hero in that. Tell me about that.
Then I saw the child. He had been recently operated. She was just 1.5-year-old baby, entirely blue, not breathing. Panic mode. What is happening? It's midnight.
What is the salary potential for an interventional radiologist? Like immediately after DM, 10 years down the line and 20 years down the line. Hey guys, welcome to the Nachiket Bhatia Show. Today's guest is someone who has done something that very few doctors in India have managed. He has topped not one, not two, but three of the most competitive entrance exam in the country. All India rank 3 in AIIMS UG in 2013. All India rank 2 in PGI Chandigarh 2019 and All India rank 1 in AIIMS SS in 2022. He is a post-DM fellow at AIIMS New Delhi, specializing in cardiovascular radiology and endovascular interventions, one of the most advanced and niche super-specialties in medicine today. He completed his MBBS at AIIMS New Delhi, his MD in radiodiagnosis from PGI Chandigarh and his DM at AIIMS Delhi. He's also completed an observership in diagnostic and interventional radiology at Children's Hospital Philadelphia, USA, beyond academics. In today's episode, we are going to talk about the journey to these three All India ranks, what cardiovascular and interventional radiology actually means, how to build a research career as a resident, and where this super niche field is headed in India. So let's put our hands together and let's welcome my dear friend, Dr. Damandeep Singh. So hi Dr. Damandeep and welcome to the Nachiket Bhatia Show.
Hi sir, how are you? Thank you so much for having me here.
Daman, you have an excellent profile, bro. You are what? AIIMS, then PGI, then AIIMS again. So I want to know everything about you. I mean, बचपन में आपको कैसे लगा कि आपको MBBS पर घुसना है and then the journey forward.
Right, so that's a long story, but I'll quickly summarize it for you. So I was born in a very humble family in Chandigarh, and my father was an ophthalmologist, and my mother is also in the public health and nutrition field and is working in government of Haryana. So my childhood was all in the government hospitals. So I used to see my father serving the population, and since he was an eye surgeon, he was addressing a bigger problem, that was the problems related to the vision, cataract. So as a younger me, I was very impressed with the idea of serving the mankind. From my childhood, my idea was clear that I have to be a doctor and I will pursue this track and serve the mankind. So this was my initial idea. So unfortunately, I lost him when I was in 10th standard. So that was a very turning point in my life, which further strengthened my belief. So when I lost him, I decided, okay, he's not here, no worries. So I'll quickly jump in and I'll take over this. So I had my 2 years of coaching in Chandigarh, and fortunately I was able to get into my dream college, which is the AIIMS New Delhi. So I joined AIIMS in the year of 2013 as MBBS student and finished my journey in 2018. So that was my journey of how and why I became a doctor.
Then again you cracked PGI. Us time I think PGI had a different exam, right?
Right.
Or INICD was there.
Yeah. So in my time, that is year 2019. So there was a separate exam for both PGI as well as AIIMS. So I had got decent ranks in both of the examinations. And during my MBBS, I would like to share a story.
Please.
So in one of my clinical postings, I saw a mother who was probably 27 and she had a child who was very sick. And I saw the child in the OPD and they were carrying an X-ray film. They did not know that what is the problem. The child was very sick. And in the OPD, she said me, Doctor साहब ये X-ray है, आप देख के बताइए मेरा बच्चा बहुत बीमार है. And at that time, I had a very limited knowledge about radiographs, and we used to read things, but actually seeing somebody come to me and asking, Doctor Sahab, ye hai, and I was not a full doctor yet because I was still in my training. So I reassured her, बैठिए, and I tried to read the X-ray. And luckily, my senior joined me, and he suggested that he has multiple areas of opacities in his lungs, and the child was very sick. बहुत ज़्यादा weight loss हो चुका था. तो अब डायलेमा हो गया कि इसको है क्या. एंड मुझे लगा ओके, हाउ कैन वी सॉल्व दिस. इनिशियल वर्कअप में एडमिट हुआ बच्चा, सारे टेस्ट हुए, एंड CT was ordered. So because he had an X-ray, we suggested it to a likely lung pathology. CT हुआ. अभी तक कन्फ्यूजन था कि उसको क्या कैंसर है. बाहर किसी ने बोला कैंसर है बच्चे को, तो वो तुरंत बच्चे को उठा के एम्स ले आए. तो मैं CT कराने बच्चे के साथ गया. जब हम लोग इंटर्न होते हैं, अकम्पनी करते हैं पेशेंट को, तो वहाँ मैंने देखा कि हाउ देर इज़ अ कम्बिनेशन, और आई कैन से कल्मिनेशन ऑफ मेडिसिन एंड टेक्नोलॉजी. हाउ अ डॉक्टर इज़ टेकिंग द हेल्प ऑफ इमेजिंग टेक्निक्स टू डायग्नोज हिम. सो वहाँ पे उसका CT हुआ. I observed the whole process. I observed how quickly the radiologist on duty saw the scan, and I saw the mother. There was an anxiety and hope in the eyes of mother that she will get an answer. Doctors, I'm not saying one specialty's scores high over another. It's a teamwork. All we are going to address is patient's hope. उस point पे उसकी mother की आँख में hope थी. She was looking at the radiologist. I was also looking for answer. And he saw the scan and he said infection है, cancer नहीं है. More than the mother, I was reassured because I was connected with this patient since the first day. So that part, that incident in my life shaped my thought कि मुझे radiology करना है. And मेरा belief firm था कि with this image, with this branch, I can integrate my medical knowledge with the ongoing advancements and help the patients and give them the hope which they're looking for. So that's how I decided to take up radiology, and on giving both the exams, the scenario became such. I got radiology in PGI Chandigarh, which is also my hometown, and I also always used to joke about this thing that people move from one place to another. They have a huge distance they have traveled. I had zero displacement in my life at that time. I was born in PGI Chandigarh, and I was doing my residence in PGI Chandigarh in radio diagnosis.
It never occurred to you that you should take medicine?
That's a very nice question. So medicine versus radiology, it is not a very easy decision. For somebody who is more interested in the technological advances such as CT, MRI, ultrasound, and even the ongoing prospects like intervention radiology, which I had no idea at that time. So I was particularly delighted about the technology part. And there were some people who used to say me कि radiology करो काम कम होगा, relax branch होगी. So there was something related with my personality. So there was a mix of my personality and my ambition, which made me select the branch. So I was not the medicine type, I can say. So for me, a medicine type person who is more sincere, reads more, spends more time with patients, and is thoroughly involved in the patient care from the day patient comes and the day patient goes from the hospital. I was looking at a branch which gives me both the things: the ability to diagnose the patients, ability to treat them, and at the same time learn more about the new technology, the innovation. So that's why I was derived more towards radiology.
Most of the doctors are not good at planning. और उसी प्रॉब्लम को सॉल्व करने के लिए I have created this planner. Plan your day, plan your goals, and execute them on a daily basis. ये मत सोचो कि रैंक 1 आनी है. ये सोचो कि आज के दिन पे मुझे कितने टेस्ट देने हैं, मुझे कितने MCQ मार्क करने हैं, और मुझे कितनी वीडियोस देखनी है। रैंक 1 तभी पॉसिबल है जब 365 दिन आप अपने गोल्स अचीव कर पाओ। इसको एक बार यूज करके देखो and give me your honest feedback. Is it really that helpful? So I'll ask you this question. So do you think Damandeep in 2019 chose radiology? The same Damandeep, if had cracked in 2025, would you still choose radiology?
Beyond any doubt, I would choose radiology.
AI doesn't scare you.
Okay, so the fact that people are asking me this question scares me. So
I'll tell you why I've asked this question
Yeah.
is because right now the biggest apprehension in every, I think, top ranker is radiology is going to be replaced by AI in the upcoming 5 to 7 years. I mean, Elon Musk has said multiple times, Anthropic CEO has told this in multiple podcasts, and the fear is apparent. And you can see in the last, I think, couple of years, people are choosing medicine and surgery branches over radiology. Okay, it's not the rank 1 branch anymore. So in 2018-19, it was a rank 1 branch. It was fixed. If you have got rank 1, you have to take radiology, societal pressure and everything you can call it. But today, the circumstances have changed. So that's why I've asked this question. Will Damandeep again choose radiology in 2025?
Right. So let me answer this question in two parts. So the first answer is yes, that I will choose radiology again if I'm given an opportunity. And the reality behind AI is that it is a technology which humans have made to help humans. Okay. So we have been using AI in our radiology practice already. It is helping us to shorten the time which we take to evaluate and analyze a scan. AI is already helping us, and we are right now in friendship mode with AI and not a competitive mode. I'm sure as the future goes on, so you see, there are number of investigations happening every day in a hospital. You name it: chest radiographs, ultrasounds, CT, MRIs. So if we can use AI tools to segregate the workflow and make the job easier for a radiologist, that is going to be the biggest utility. AI per se is, in my opinion, not so fit enough to replace radiologist. It can always help radiologist. It will make the life easy of radiologist, and it can act as a team. So we can use it as a tool to assist us.
Okay, that's a goody answer. So I'll give you a scenario here.
Yeah.
Now imagine right now how many radiologists do you have in your department right now?
We have a total of 14 radiologists.
14
Yeah.
radiologists. So 14 radiologists is accommodating to how many patients approximately?
So if you say per day footfall in my department would be between 100 to 150.
All right, let's suppose 100 people.
Yeah.
So in average, you are doing around 6 people per person?
Probably, right.
Yes.
Yes.
Now imagine AI. I'm sure. AIIMS has also done a fully automated MRI. Tha kya tha wo?
That was a chest radiograph, so
Yeah.
chest X-ray. So is in the part of the OPD as initials as a experimental mode. AI has been implemented,
Yeah.
so it can triage out the X-rays, and which are normal, it can say it's normal. Which do have some findings, so radiologist needs to validate that.
Yes. So now imagine the whole process actually gets simplified, and AI does the complete midwork, and
Yeah.
you only need one radiologist to sign off the final work from an AI. Don't you think that the complete 100 patients can be managed by a single radiologist in the upcoming 5 years? Why do you need the extra 5 people?
Right. So the answer to this question is that no matter how many scans the AI does, the number of scans and the disease proportion each day in India is growing. So it is a continuous race. We cannot say that today AI has come and it will do the job and will be okay. There are many errors in AI, and a radiologist cannot fully trust AI. He needs to cross validate that. For example, if I am getting suppose a CT done for somebody very close to me, and the CT is done and I get a report by AI. Now we are talking about a realistic scenario, whether or not I will be comfortable enough to trust the report, or whether I will still want a validation. I will personally want a validation from a person who is trained. So there are two things. Number of patients, number of investigations, they are increasing day by day. There is always a need when there is a positive finding, when there is a dilemma. AI can predict patterns. AI can say dark, white. AI, what the human mind is capable of is having a memory, having experience, and say what this white is. Like, for example, in that child which I was saying, there were white patches. AI will say, okay, white patches in lungs, and it will list down all the possibilities. If you would have used ChatGPT or any other platform, it will list down all the possibilities. And you will have a report saying opacity in lung, likely infection, malignancy, granulomatous etiology, and whole array of things. Now this report goes to the clinician. He will read and himself get confused. What do the clinician need when they send a patient to a radiologist? They need a opinion. They need a differential diagnosis that you narrows down. It, definitely there will be some overlap, but narrow it down. Use your the skill you have, the experience you have, narrow it down. So yes, if we say a greater workload, AI can manage the things, AI can sort it, but when it comes to validation of results, we still need humans.
या इंडिया में कोई तो चाहिए ना इसको चाटे मार सके पेशेंट कहाँ जाएगा
So इससे मुझे याद आया कि there is a concept called fixing radiology when AI fails. So what do you do when AI fails? Whom do you sue?
the radiologist
If there is no radiologist, you sue the machine.
yeah you can't sue the
You can't sue a machine. So
machine
my
is legally
concept is-
protected radiologist isn't
right, absolutely. So I will to the new generation, which that was the second part of your question, that with whether they should be scared or not. My the statement or my thing will be like, if you are interested in a branch, do not think about the outcomes. Your passion, your interest is what drives it. Do not opt anything. Do not opt medicine by fear of surgery. Do not opt surgery by fear of anything else. Whatever passion you have, you do that. Nothing can stop you.
talk about your SS. I mean, you chose interventional radiology, right?
Right.
What was the reason behind that?
Like I said, I did my radiology training in PGI, and my interest was in cardiothoracic imaging, and also my interest was building up in intervention radiology. So it was coming up as a minimal invasive branch, which it is, for a easy term, it's a pinhole surgery. So it's not essentially a surgery, but it's a procedure which is done using some sort of imaging guidance. It can be an X-ray, it can be CT, it can be ultrasound. So wherein the radiologist comes in because he has the idea of anatomy, he has the idea of the imaging technology, he's comfortable how to see the patient under that imaging. It is slightly different from surgery, and how through a small pinhole he can effectively treat multiple things and reach anywhere in the body using a very small entry point, probably in your wrist or in your groin. So I was very fascinated by the idea of intervention radiology. Simultaneously, I was having a very nice interest in the cardiothoracic imaging. So that's why I opted to appear for the AIIMS SS, and I chose a cardiovascular radiology and endovascular interventions, and I obtained rank 1 in AIIMS SS 2022.
Now I'll go back to your PGI and AIIMS things. So
Right.
tell me the difference that you found between PGI and AIIMS.
Being studied in both the places, the training in AIIMS was different than PGI, I will say. So the AIIMS had better structure. There was more time for me as an undergraduate to do things, and AIIMS had a very nice mentorship. And this is my undergraduate experience. Now, since I went to PGI for my post-graduation experience, I do not have the postgraduate experience of AIIMS. So I can say about PGI. So definitely it was like, if I say about my residency life or my radiology training, there are two aspects. डेफिनेटली PGI हैज़
एज अ
मोर
कॉलेज,
वर्कलोड.
दोनों में जैसे कॉलेज है, ठीक है, उनके कल्चर में आपको क्या डिफरेंस लगा कि एम्स में यार ये अच्छा था और पीजीआई में ये अच्छा है?
सो एम्स में अच्छा था, इट वॉज ऑलवेज अबाउट पुशिंग यू and it will always promote you to explore your potential in whatever area of interest you have. PGI is extensively focused into the patient care. So the first and foremost thing that you have to do is patient care, and there can be no, negligence in that. You have to extensively focus into that. Rest of the things do come later, but the main difference, I'll say, so AIIMS offers you a platform where it will support you and push you no matter what you want to do. The PGI, it was definitely a wonderful place. The main area is patient care. You have to be on your toes, you have to manage the patients. Probably it has something to do with the number of patients it's getting. It's very common these days, they say AIIMS से patient refer हो जाता है, and it's all over the comedy channels.
Yeah, it's normal, right?
Yeah, so what I feel, AIIMS was initially built as a place of research, academic excellence, and to try novel therapies, novel treatment modalities. It is a hospital, definitely, but its prime area is research, innovation, and to see about the new technologies. PGI has a demographic challenge. It is located in Chandigarh. It's a place which has referral from all around, and it does not have any bent. AIIMS has options.
Safdarjung.
So AIIMS can refer the patient to nearby hospitals, while PGI cannot.
तो अच्छा कौन सा हुआ, एम्स हुआ पीजीआई हुआ?
अच्छे,
चूज करना पड़ेगा लेकिन एक।
अच्छा, अभी चूज करना पड़ेगा. देखो, छोटे बच्चे जो होते हैं उन्हें हमेशा अपना घर पसंद होता है. तो क्योंकि जब मैं छोटा था तो AIIMS आया था, तो मेरे लिए AIIMS ही अच्छा है.
पीजीआई वाले नाराज हो गए सुनकर।
नहीं, PGI वालों को मेरा पूरा प्यार और रिस्पेक्ट हमेशा है. PGI ने, मैं जो भी लाइफ में बन रहा हूँ, जिस प्रोसेस में हूँ, उसमें PGI का जो योगदान है वो कभी भी मैं उनका दे नहीं
पीजीआई में
सकता.
खराब बात क्या है? पीजीआई में मुझे बताओ कि जब आप JR1 थे तो आपका रूटीन क्या था और आपके साथ क्या होता था?
ठीक है, एक बड़ा फनी किस्सा मैं आपको सुनाता हूँ. मैं जैसे कि मैंने आपको बताया, मैं AIIMS से आया, PGI मैंने ज्वाइन किया रेडियोलॉजी, और दोस्तों ने बोला कि चिल ब्रांच है, कि तू फ्री हो जाएगा, 4 बजे मिलना, ये वो. और सभी दोस्त मेरे मेडिसिन, सर्जरी और कुछ रेडियोलॉजी में भी थे. मेरे माइंड में था कि मैं जल्दी फ्री हो जाऊंगा. मेरी पोस्टिंग लगी सिटी, और उसमें जो जूनियर मोस्ट का जो कंसेप्ट होता है, तो जो जूनियर मोस्ट JR है, ही इज़ रिस्पॉन्सिबल फॉर एवरीथिंग. ही इज़ रिस्पॉन्सिबल फॉर द पेशेंट वर्क फ्लो. कितने पेशेंट्स आ रहे हैं, उनका स्कैन हो गया, उनकी हिस्ट्री ले ली. लोग कहते हैं कि रेडियोलॉजी क्लिनिकल ब्रांच नहीं है. पेशेंट आ रहा है, मुझे उसके कार्ड देखने हैं, उसको ये स्कैन क्यों एडवाइस किया है, उसकी फ़ोटो लेनी है, अपने सीनियर्स को भेजनी है, व्हाट्सएप ग्रुप पे डालना है, सभी स्कैन्स को अपने सीनियर रेजिडेंट के पास देना है. वो उस पर प्रोटोकॉल लिखेंगे कि उसका वाकई में क्या CT स्कैन होना है, what investigation he has to undergo, whether it has to be a arterial phase, venous phase, or simple CT. And at the end of the day, there are 3 CT machines, so you can say 3 rooms. At the end of the day, I have to run to 3 rooms, collect those forms. If any form is missed, then it's on me. फॉर्म कैसे खो गया? वो फॉर्म इकट्ठा करना है, एक बंच में रखना है. Every senior will come and go and put her initial. Suppose it's me, I will write D, कि वो मेरा स्कैन हो गया है, उसको मैं रिपोर्ट करूँगा. At the end of the day, so by 6:30 सभी स्कैन्स हो जाएंगे, फिर सब लोग बैठ के रिपोर्ट करेंगे. मैं जूनियर मोस्ट हूँ, मेरी बारी सबसे लास्ट में आएगी. कंसोल्स तो लिमिटेड है, 100 स्कैन हो गए दिन में, 5 लोग हैं, 4 लोग हैं, 2 या 3 कंसोल हैं, तो वो अपना रिपोर्ट कर रहे हैं. मैं अब वेट कर रहा हूँ. जब उनका स्कैन हो जाएगा ख़त्म, तो मेरी बारी आएगी. अब रात के 11 बज चुके हैं, हॉस्पिटल में मैं अकेला बैठा हूँ, और स्कैन रिपोर्ट करना स्टार्ट कर रहा हूँ। नया नया हूँ, 10 स्कैन भी रिपोर्ट करूँगा, 2 घंटे लग जाएंगे। रात भर ये किया, सारे स्कैन ओके किए, घर चला गया। सुबह अलार्म लगाया 7 बजे का, भाग के आया, साथ वाले रिकॉर्ड रूम से सभी की फिल्म्स कलेक्ट करके लाया, सीटी रूम में रखा, फिल्म्स गिनी, 6 हैं, 5 हैं, 3 हैं, फिल्म कम होना मेरी रिस्पॉन्सिबिलिटी। रिसीविंगली फिल्म यहाँ रखी, और सभी रिपोर्ट्स जो लास्ट सबने की लास्ट पिछले दिन, मुझे वो सभी का प्रिंट आउट इंश्योर करवा के रखना है। तो 100 रिपोर्ट्स हैं, कंसल्टेंट्स की फाइल में रखना है रिपोर्ट। तो इस तरह मेरा एक यूजुअल डे था। तो पोस्टिंग के एंड तक ऐसा हो गया कि मैं अलार्म से पहले खुद ही उठ जाता था। इसके लिए मेरी बहुत सीनियर प्रोफेसर थी, उन्होंने मुझे बहुत प्रेज़ किया और बहुत सपोर्ट किया एट द एंड ऑफ द मंथ कि यू डिड अ वेरी नाइस जॉब, बट दैट्स व्हाट इट इज़।
हमें इतना नॉर्मल कर लिया ना हमने इस चीज़ को कि ये 32-34 घंटे की ड्यूटी तो नॉर्मल है।
बिल्कुल सही कहा आपने। सो वी हैव टर्न दिस इनटू अ नॉर्मल थिंग एंड विच आई थिंक इट शुड नॉट बी।
What happened when you made a mistake?
When what happened to me is what happens to everybody.
दिल से बता रहा।
जैसे अगर एक छोटा सा एग्जांपल दूंगा बिना किसी को नाम लिए, एक रिपोर्ट प्रिंट नहीं हुई गलती से, या फिल्म इधर की उधर हो गई, तो आपको सुनाया जाएगा, आपको फील कराया जाएगा कि यू आर रॉन्ग, इट वॉज योर जॉब। बट आई यूज टू थिंक वेदर इट इज रियली माई जॉब टू, बिकॉज
देखिए तो है तो लैब असिस्टेंट की जॉब ही है, इट्स नॉट JR1 जॉब।
अब एक सिस्टम ऐसा है। तो मैं रोज सोचता था क्या ये मेरी जॉब है, और उस पॉइंट गलती के लिए आपको जब सुनाया जाएगा तो आपको बुरा लगेगा।
कितना सुनाया जाता था?
अगर मैं अपने थ्रेशोल्ड से बोलूँ तो मैं बोलूँगा कि मॉडरेट सुनाया गया। लेकिन किसी का थ्रेशोल्ड सब्जेक्टिव चीज़ है, ये कोई इसको कह सकता है कि बहुत भी सुनाया गया, और जो बहुत ही एक काइंड ऑफ जिसके स्ट्रॉन्ग बंदा है वो बोलेगा कि कुछ नहीं, ठीक था।
गाली पड़ती थी माँ बहन की?
नहीं, ऑनेस्टली ये मैं बोलूँगा कि ऐसा कोई अब्यूजेस और ये सब नहीं, बट येस मेडिकल प्रोफेशन में अब्यूजेस नहीं होते आपको। पहले आई एम नॉट श्योर कैसा था या और कहीं कैसा है, बट मेरे एक्सपीरियंस में अब्यूजेस कभी नहीं, बट येस बोला जरूर गया है।
पब्लिकली करते थे?
पब्लिकली आप नहीं कह सकते, आपके कलीग्स के सामने कह सकते हैं। जैसे कि देखो, ऐसा कभी नहीं होगा कि आप 1 to 1 हो, आपके पास हमेशा कोई होगा, या तो आपके पास पेशेंट्स होंगे या आपके कलीग्स होंगे। तो
अप्रिशिएट नहीं करते ना, मतलब वही आप जितना भी काम कर लो उसकी अप्रिसिएशन नहीं होती, बट एक गलती है तो बस उसको उसके लिए आपको सुनाया पूरा जाएगा।
इससे मैं कह सकता हूँ कि ये एक ऑकवर्ड ट्रेंड है कि जूनियर को लाइन पर रखना है। एक गलती किया, सुनाओ, इससे ये एक्सपेक्ट किया जाता है कि वो फिर उससे सुधर जाएगा और अपनी लाइन पे आएगा। बट मेरा ये मानना है कि हर बंदे का चीज़ों को सुन के रिस्पॉन्ड करने का और उसको एक्सेप्ट करने का नज़रिया डिफरेंट हो सकता है। ए पर्सन सुन के उसको ज़्यादा दिल पे ना लगा के अपना सोच के कि यार कोई नहीं, मैं ये आगे से नहीं करूँगा। एक पर्सन बी जो शायद उसकी लाइफ में और कुछ इमोशनल चल रहा हो, वो घर से दूर है, उसको खाना नहीं मिल रहा, वो 12 घंटे 13 घंटे ड्यूटी पर है, उसको ऐसा ट्रीटमेंट मिला, तो वो हो सकता है इसे एक्सेप्ट ना कर पाए। और इसी वजह से मैं बोलूँगा कि जूनियर्स में स्ट्रेस ऑनेस्टली रहता है, और ये स्ट्रेस जब तक मैं खुद सीनियर नहीं बन गया तब तक था।
JR2 बन के आपने करी टॉक्सिसिटी?
मैंने इसको मैं ऑनेस्टली पूरा डिनाई भी नहीं कर सकता।
ऑनेस्टली बताओ क्या किया?
हाँ, ऑनेस्टली मतलब ऐसा जैसे ऐसा बहुत बड़ा नहीं किया जिसमें मैं उसको टॉक्सिसिटी का लेबल कर दूँ। बट मान लो मेरे सामने भी कभी कोई गलती हो गई, कुछ मिसप्लेस कर दिया, कुछ भूल गए, तो बोला ज़रूर है। लेकिन मैंने कोशिश हमेशा ये की कि ऐसा ना कुछ कहूँ कि उसको दिल पे लगे। उतना कहूँ कि मेरी बात बस कन्वे हो, लेकिन वी ऑल आर ह्यूमंस. हो सकता है कि जाने अनजाने में मैंने कुछ कहा और किसी ने उसको परसीव किया हो. सो आई थिंक फ्रॉम योर प्लेटफॉर्म आई कैन अपोलोजाइज टू एवरीबडी दैट आई रियली डिड नॉट मीन दैट.
आई एम ग्लैड यू फील दैट. आई एम जेन्युइनली ग्लैड.
थैंक यू.
बिकॉज वही अभी ना उस सिस्टम में रह के सबको बस सिस्टम जैसे बन जाते हैं एंड दे एक्चुअली फील दैट व्हाट दे आर डूइंग इज एब्सोल्युटली राइट. आई एम ग्लैड यू हैव दैट काइंड ऑफ फीलिंग इन यू कि व्हाट यू डिड वाज रॉन्ग. दैट मैटर्स एक्चुअली.
I certainly do. But over the years, I have, in my years of academic training, I have tried to, be a nice senior and as a supportive senior. Because I have gone through things, I know how hard it is. Especially कोई अपने घर से बहुत दूर आया है, तो मैंने उसको कोशिश ज़रूर की है अपने लाइफ में उसको इंकलकेट करने की. पर लेकिन जैसे मैंने कहा कि हो सकता है कि मैंने भी कभी अननोइंगली कुछ कह दिया हो.
एसएस के दिन कैसे थे सुपर स्पेशलिटी के?
सुपर स्पेशलिटी, इट वाज अ रियली नाइस एक्सपीरियंस बिकॉज इट वाज माय फेवर्ड ब्रांच. मुझे जो करना था, आई वाज इनटू दैट एस्पेक्ट. एंड let me also highlight you why I actually thought about this. Many people will think, okay, either you do intervention radiology or you do imaging. But I wanted something which is a combination of radiology also has intervention. They cannot function as a single hand tool. We need a team. So there has to be a team of pediatric cardiologists, CTVS surgeons, and the cardiothoracic radiologist, because it's ultimately the patient. Patient does not need a scan only. Patient needs treatment. So currently finding such places where there is a teamwork between these three broad specialties is rare. So that's why I'll say ये अभी apex referral centers में ये branch है. But I'm sure with the evolving healthcare in India, all the trainees mostly they will go to places and they set up the teamwork. So, and as I said earlier also, we have huge number of patients. The waiting list in AIIMS is sometimes as high as 3 years for a cardiac surgery for a child. लेमैन भाषा में माँ बोलेगी बच्चे के दिल में छेद है. अब उस बच्चे को एक राइट डायग्नोसिस चाहिए, उसको प्रोग्नोसिस चाहिए कि कैसा उसका बचपन होगा, क्या वो ठीक हो जाएगा, और उसको सर्जरी चाहिए. कभी कभी सर्जरी नहीं तो एडवांस तरीक़ों से एंडोवेस्कुलरली भी बंद किए जाते हैं वो डिफेक्ट्स. सो ऐसा सिस्टम होना, आई थिंक विद द ग्रोइंग इंफ्रास्ट्रक्चर इन इंडिया, आई एम श्योर कई जगह पे ओपन होगा. बट देयर इज़ अ डेफिनेटली अनमेट नीड फॉर दिस. वी शुड हैव दिस सेटअप्स इन इंडिया.
You believe you have done a lot of research and publications. Tell me about that.
सर मेरा ये मानना है कि एक स्पेशली एक ट्रेनी को फोकस करना चाहिए. अलॉन्ग विद हिज एजुकेशन ही शुड फोकस ऑन रिसर्च, ही शुड फोकस ऑन पब्लिकेशंस, बिकॉज दे आर द डिजिटल थंबप्रिंट्स ऑफ एनी ट्रेनिंग. थैंक्स टू माई मेंटर्स जो मुझे मिले PGI में और AIIMS में, जिन्होंने मुझे मोटिवेट किया दैट आई शुड, along with my duties, along with my academics, I should learn basic research, try to write things up. If मैं गलत हो सकता हूँ तो I will go to my mentor, they will correct me. And with this, it day by day, maybe say month by month, you put up your effort.
But you must have some kind of inspiration. एक गोल तो होगा ना कि मैंने पब्लिकेशन इसलिए करनी है. And you don't have small number of publications. You have 46.
It's maybe now touching 50.
50 publications के लिए आपको एक गोल तो होगा ना कि मुझे पब्लिकेशन करके ये चीज़ अचीव करनी है. वो क्या थी?
ऐसा कुछ एक पर्टिकुलर गोल नहीं कि मुझे पब्लिकेशन करके ये अचीव करना है. इट इज़ बिकॉज व्हेन आई यूज टू रीड, तो हमारी मेन जो पढ़ाई है, टेक्स्ट बुक्स तो हैं, लेकिन अब मेन जो आपका लर्निंग सोर्स है वो आर्टिकल्स हैं. आप पढ़ते भी आर्टिकल से हो, आप कुछ कन्फ्यूजन होती है, आर्टिकल्स को आप प्रेफर करते हो. गाइडलाइंस जो आती हैं, सपोज आपने पढ़ा आज ये गाइडलाइन आ गई, तो वो कोई किताब में नहीं आती, वो एक पेपर है. सो मुझे फैसिनेशन थी, एक इंटरेस्ट था कि जैसे हम कोई चीज़ पढ़ते हैं तो उसमें एक आर्टिकल पढ़ा, मैंने ये पढ़ा, मैंने कोई रेयर फाइंडिंग देखी, अच्छा वो ऐसे डिस्क्राइब्ड है. दैट ऐसे मुझे स्टार्ट हुआ कि अगर मैं कोई रेयर चीज़ देख रहा हूँ, कोई रेयर फाइंडिंग देख रहा हूँ, I should publish it so that it comes on a platform where it's accessible to anybody worldwide. कोई किसी भी सेटिंग में वैसी फाइंडिंग देखेगा तो he can refer to it and put a diagnosis. This is just a small example कि ऐसा कोई broader goal नहीं कि मुझे ये हासिल करना है. I inculcated this into my standard training कि I should do, a resident should know research, they should know basic way to how to write a manuscript, how to go on with the publishing. So that I feel everybody should know.
You have presented papers internationally also, right?
Right. So I presented my thesis in the ARRS conference. It is held in Boston. So I was awarded the best paper award there. Also, I have presented multiple papers in many other platforms, which are in Spain and Dubai. I have also been to South Korea. So what I realized that when you do research and you should also present your research.
Do you get invites from these places or do you apply to present there?
As a trainee, you do not get any invites. Invites are for the faculties who get an invite to give a talk or be a moderator or a chairperson, while a resident or a trainee has to submit his or her abstract कि मैंने ये रिसर्च किया है, ये मेरी प्रिलिमिनरी फाइंडिंग्स हैं, मैं ये भेज रहा हूँ. सो ये कॉन्फ्रेंसेस में यू विल मीट अ होल बंच ऑफ पीपल who are from different parts of world, and they will see your paper or hear you give their inputs. You will learn कि मुझे क्या नया करना है, where I am lacking, or sometimes if you're doing good, they will appreciate you.
So I'll ask you a basic question here.
Yeah.
Like many a times I've found, residents message me आपकी सर मुझे इस conference पे जाना है. So are the flight tickets and hotels paid? So is it paid or do you have to pay for that?
It depends. Like currently बहुत सारे ऐसे scholarship programs होते हैं which I have also fortunately got. I got the SCRB grant which is now called as ANRF. So जब आपका कोई पेपर एक्सेप्ट होता है, आपने कहीं भेजा, वो एक्सेप्ट हो गया, या वो ओरल होगा या पोस्टर होगा. कुछ कॉन्फ्रेंसेस होती हैं जो ट्रेनीज़ को फ्री रजिस्ट्रेशन दे देती हैं और ट्रैवल सपोर्ट दे देती हैं. Like I had gone to South Korea, so I had free registration and I got a complimentary travel support. Same was true for Japan. So these two places, I got the opportunity to travel in free. For US, so it was an expensive trip for me. तो मैंने उसमें ये ग्रांट अप्लाई किया एंड केस टू केस बेसिस पे वो ग्रांट अगर एक्सेप्ट होता है तो ट्रेनीज़ को टू एंड फ्रो फेयर registration, even visa fees they will get. So I got that. And in addition, there are multiple
I think this
platforms.
is a very good learning for every one of us. कि without grant it becomes very difficult यार. 2-2.5 लाख रुपए का ट्रिप कहाँ से बनाएगा बच्चा?
I understand. It's really difficult. But I encourage everybody that you should wholeheartedly apply to these grants and go through proper channel. अपना पेपर वर्क पूरा रखो, डालो, आपको हाई चांसेस है कि मिलेगा. एंड वंस यू गेट इट एंड यू फील वेरी गुड कि आप ट्रैवल कर रहे हो. एंड आई फील गवर्नमेंट के ये ग्रांट्स आर टू सपोर्ट द यंग इंडिविजुअल्स कि वो ये एक्सपीरियंस कर पाएँ, वो वहाँ जाके कनेक्ट कर पाएँ लोगों से, अपने कनेक्शंस बिल्डअप करें, अपना रिसर्च प्रेजेंट करें, सीख के वापस आएँ. दैट्स आई थिंक तो ये एवरीबडी शुड एक्सप्लोर दिस आइडिया. And I'm always reachable if somebody really wants to have a thought about these grants. I'm very reachable.
You had a movie moment in your life. You played a real life hero in that. You guys, if you don't know, I mean, he saved a child's life in an airplane. Actually convinced the pilot to land. The flight was for Delhi. He made the flight land in Nagpur, and the team, they were like 4 to 5 people. They actually saved the child. Tell me about that.
Oh, thank you so much for bringing this up. And truly, that was a very remarkable experience for me as a doctor. So, I will also give credits to my partner, my wife. She was traveling with me. She's an anesthesiologist, and I'm still very thankful that she was traveling with us. But never say, we were group of 5 doctors traveling from Bangalore to Delhi. We had attended a conference, and as soon as the flight took off, we got an announcement that is there a doctor on board. This is not a very common thing I'll hear, and one or twice I've heard there is somebody maybe having some anxiety or palpitation, तो we'll go and help. इस बार 2 बार अनाउंसमेंट हुआ तो मैंने देखा तो ऑलरेडी जो मेरी वाइफ और मेरे 3 और फ्रेंड्स थे वो सभी उठ गए थे.
फ्रेंड्स कौन कौन थे?
फ्रेंड थे वन ऑफ माई इस कॉलेज सीनियर तो ऋषभ जैन, उनकी वाइफ डॉक्टर ओशिका, एंड माई DM senior Dr. Avichala, and my wife Navdeep Kaur. She was there with me. So we were traveling. So all of them rushed, and I was amused ki what is happening. And there was what we saw. My wife was the one who first responded, and she said, "There's a blue baby. Blue baby hit something in me. I'll tell you something about blue baby later on also." So I thought, okay, how? Then I saw the child. So he had been recently operated. She was just 1.5-year-old baby, entirely blue, not breathing. And I asked the parents, what happened? So they said surgery hua hai. And I quickly had gone through their documents. And I was fortunate that I have had training in cardiovascular radiology, and I could understand what was the anatomical oddity with the child, what issue he had, and what surgery was been done. So that gave me an idea, okay, that this child has been recently been operated for a complex congenital heart disease, and now since we had gone up in the air, there was hypoxia. The child could not maintain it and collapsed in mother's arm. Now there was a entire distress. So my wife, she took the charge as the team leader, and we all of us, stood by her. We performed our respective duties, and we started the CPR. We had the IV cannula access. There were basic drugs available within the airplane, and I immediately spoke to the pilot that we have an emergency, and I don't think the child looks well. And he said that we are probably somewhere over Mumbai. I said, we need to get down. We cannot go to Delhi. It was still 2 hours to go. And the situation was turning slightly odd. So I had to counsel the parents that, okay, आप थोड़ा सा वेट कीजिए, ट्रस्ट कीजिए, हम डॉक्टर्स हैं, हम आपके बच्चे को देख रहे हैं. और उन्होंने हम पे ट्रस्ट दिखाया. उस वक्त प्लेन के लिमिटेड रिसोर्सेस, जैसे कि ऊपर ऑक्सीजन वाला जो मास्क है, उसका सिलेंडर, पेपर कप्स, ये सब से हमने ऑक्सीजन स्टार्ट किया.
बताओ ना कैसे बनाया, वही तो मेजर बात है.
तो आई थिंक उसको हम जुगाड़ कह सकते हैं.
बताओ कैसे बनाया.
तो मुझे ध्यान आया कि ऑक्सीजन, क्योंकि जब आपको कोई आपके सामने कार्डियक अरेस्ट है, ये हर डॉक्टर को इसकी ट्रेनिंग दी जाती है और उसको पता होना चाहिए कि कैसे रिस्पॉन्ड करना है. आपको उसके वाइटल्स देखने हैं. अगर वो नॉन रिस्पॉन्डिंग है, आपको तुरंत CPR इनिशिएट करना है. और बच्चों में और अडल्ट के CPR में थोड़ा सा डिफरेंस होता है, लेकिन ऑक्सीजन उसका एक हॉलमार्क है. ऑक्सीजन देना है आपको. तो मुझे ध्यान आया कि जब वो हमें इंस्ट्रक्शन देते हैं, जिसमें हम कई लोग ध्यान नहीं देते, कि ऑक्सीजन की कमी होने पे मास्क नीचे आएगा. सो आई सेड, आप वो सिलेंडर लाओ. वो मास्क तो बच्चे के लिए बहुत बड़ा है, उससे तो हम नहीं दे पाएंगे. तो हमने वहाँ पे व्हाट यू कैन से अ जुगाड़ मास्क वी मेड. वी कनेक्टेड दैट पाइप. I cut that thing with my teeth, because there was no scissors. It's not allowed in the plane. You can't carry something sharp. So काटा, कप से जोड़ा, उसको एक makeshift mask बनाया वहाँ पे. ऑक्सीजन स्टार्ट की, CPR स्टार्ट किया. माई वाइफ टुक द कैनुला. सो वी हैड अ ब्लड लाइन एक्सेस, एंड वी हैड सम बेसिक ड्रग्स. स्टार्ट गिविंग द ड्रग्स. और CPR के बाद बच्चा रिवाइव होना, बच्चे की पल्स आ गई. हमने कहा रिवाइव्ड. वी कॉल द पायलट कि दिल्ली तक नहीं जा सकते, आपको लैंड कराना है, सिचुएशन इज ट्रिकी. सो ही मेड अ कॉन्टैक्ट विद द नागपुर एयर स्पेस, एंड वी कॉल्ड देम दैट प्लीज सेंड एम्बुलेंस which should be fully equipped with everything. And in the meanwhile, I was talking, the child had another arrest. Again, the whole thing started. The panic is going on, and but the flight is rerouted to Nagpur. The announcement is made. Everybody is in a panic mode. What is happening? It's midnight. So we counseled everybody that it's okay. It's about somebody's life. therein where I felt that how it is important for a doctor to have important communication skills. आपको बात करना है, आपको समझाना है, सिचुएशन को हैंडल करना है. कई इंस्टेंसेस में हम कम्युनिकेट ठीक से नहीं करते हैं, विच लीड्स टू अननेसेसरी ट्रबल.
उसके बाद क्या हुआ लैंड होने के बाद?
लैंड किया, इंटुबेशन ट्रे थी, इंटुबेट किया, बच्चे को वाइटल्स उसमें, क्योंकि आपको जो एम्बुलेंस आई थी इसमें सब कुछ था, सिस्टम, वेंटिलेटर था, बेसिक जो था. बच्चे को सेफ सिचुएशन में हमने हैंड ओवर किया, उनके पेरेंट्स को नमस्कार किया, एंड देन वी रिटर्न बैक टू दिल्ली. दिस होल प्रोसेस टुक अराउंड 2.5 to 3 hours. It was a very nice moment for me and my whole team of friends were there, and it was a very shaping moment. इसने हमारा बिलीफ जो होती है कि आप कहीं पे भी परफॉर्म कर सकते हो, अस्पताल में नहीं तो क्लाउड्स के ऊपर भी, आसमान के ऊपर भी परफॉर्म कर सकते हो, ये फ्रॉम दिस
The
इंसिडेंट,
government called you up, right? After that,
राइट.
the government called you.
So it was like since we were part of the AIIMS, and the director of AIIMS, they invited us over, they felicitated us, and there was also a media briefing. So it was altogether, I can say, a different
Celebrity
experience.
moment.
I will say that, yes. तो कुछ टाइम के लिए वो वैसा एक्सपीरियंस ज़रूर था. But I'm sure one thing which came out from that was how everybody should be equipped to handle these situations, and how airlines should have more, they should ensure everything is there in the plane. Yeah.
मुझे you know, I think I still remember when this happened, and it is a goosebump moment because you imagine something like this happening in mid-flight. The mortality rate is so high.
Right.
कि अगर शायद तुम ना होते तो the whole system is not equipped to handle such kind of things.
Right.
वरना वो कहते तो यही है ना, the air hostess को सिखाया जाता है, the flight crew is taught CPI and everything.
Sure. Yes.
Were they also helpful in the whole situation?
They were helpful in terms of providing us things which we were asking.
CPI करवाया आपने उनसे?
नहीं, CPR नहीं करवाया उस दिन. But I am not really sure how would that turn up. But yes, I'm not exactly aware what are the norms for the training, but I'm sure everybody should have, because this can happen in any flight. And if it happens in a, God forbid, an international flight, and you may not have a doctor on board every time.
So tell me, after DM, let's suppose from doing a DM from AIIMS, what is the real career options in front of you?
Okay, for somebody who has passed a DM from AIIMS, can have multiple career options. Either he can directly venture into the corporate setup and can join in any corporate hospital, and he can perform interventions, he can take part in the cardiac imaging team. Either he or she can set up their own private clinic with some investment, and he can start doing basic interventions and be like an entrepreneur. So he will be the master of his world. So he can start up basic cases, and eventually as the capital flows in, he can make a team of colleagues who are intervention radiologists or cardiothoracic imaging. They can form a team and open up a place. Or somebody may still continue to be an academic institution if somebody is oriented towards academics, loves teaching, and is involved in research. So he or she can also aspire to join the government institutions as an assistant professor, because this DM is equivalent to your senior residency, and it makes you eligible to become an assistant professor in any central or state university.
Does this path of AP, professor, HOD financially viable in 2025? Actually 2026?
Okay, so in terms of financial viability, as you said, even my salary as a DM resident was enough for me to sustain me. And as soon as a person is elevated to a rank of assistant professor and hitherto is get promoted, so there is a decent salary. But absolutely I agree that there cannot be a comparison in these two setups, because they are entirely different. So one is in a government setup with entire pay band and pay scale system, while the corporate system is entirely different. So yes, me being on this side, so I'll say it is sustainable. Yeah.
And this is the most important question of our podcast. What is the salary potential for an interventional radiologist? Like immediately after DM, 10 years down the line and 20 years down the line.
A person who finished DM and immediately joins a hospital outside can get somewhere between 3 to 5 lakhs
Okay.
as a starting package. And as he or she works in that system and is able to perform procedures, and most of these procedures are involving the new technologies, there is evolving hardwares, and there is whole amount of new devices which are available. So his incentives and salaries, if you say 10 years down the lane, he can, if he's doing really well, he can touch up to 10 to 15. And if we're talking about somebody who is 10 or 20 years down this in this lane, and he or she will be likely be one of the branded people in this chain, so they can, I mean, sky is the limit.
That's a great answer, actually. And I'll ask you the last question. You are the vice president of RDA in AIIMS. Now,
Right.
imagine you are the prime minister of a country for a day. What are the things that you will fix in the broken system?
So if you say me that I am the prime minister, so now the system becomes into various parts. So there are multiple stakeholders, but I think I'd like to answer about the trainees and the residents, because that's the experience which I have. So I will mandate the limited working hours and focus more on the mental health and overall well-being of these residents, because ultimately residents are the workforce. They are the ones who, along with the support of consultants, keep the hospital up and running. So my number one task is to mandate fixed limited working hours and ensure everybody gets time. So this is one thing which I would like to do.
Thank you so much, Damandeep. I think we have some rapid fire questions for you.
Oh, right.
All right. Very simple 2 rules. You have to be super spontaneous and super truthful. All
Okay,
right.
right.
One city in the world you would live if not India.
Ibiza.
Nice. Tea or coffee? And if yes, how many cups a day?
Right. So it's both tea and coffee. Tea is like 3 cups a day, coffee 4 cups a day.
Last movie or series you actually finished watching?
Right. So the last series is Mamla Legal Hai.
Second?
Second.
मेरा बचा है अभी तक. The one person whose career in medicine you quietly admire the most?
Right. So it is Sir Vivian Thomas. So Sir Vivian Thomas was actually a black colored janitor in the United States who, along with his cardiothoracic surgeon, he rose up to become a cardiac surgeon, and he invented the Blalock Thomas Toxic shunt. It is a shunt which saves the blue babies. So there's a very nice movie about it,
Yeah,
something the Lord made. So yeah, this
So
is
है ना Snape है.
yeah.
Snape
Yes,
is there
exactly.
and
So
Black Panther is there.
correct. So Snape is like the Sir Alfred Blalock, and the guy is Vivian Thomas, and so I quietly admire him.
If you weren't a doctor, what would you be doing right now?
I think I will probably explore my venture into the civil services.
Politician, भाई तू बना है politician के लिए. What's a skill completely unrelated to medicine that you have been meaning to learn?
Finance and stocks.
Best meal you have had and where?
I guess so. It's butter chicken at Gulatis.
Thank you so much, Dr. Damandeep. It was a lovely conversation, a very different perspective about interventional radiology, and yes, how important research is.
Thank you so much for having me here. It was likely so wonderful to talk to you.
Thank you so much. And thank you so much, guys, for watching today's podcast. Interventional radiology completely dissected by Dr. Damandeep, how important research is and what actually matters when you enter into PGI, AIIMS, and what things make them special. Thank you so much. Share this with a friend who is looking to become a radiologist in the future and plan to do DM in interventional radiology. Thank you so much. And as always, do not forget to share, like, and subscribe. Thank you and God bless you.